So let's get started. First of all, I just want to give everybody accolades for making it here tonight. You could have been lounging at home in a chair and watching your favorite show, but you made the decision that your health is going to take a priority. And so I'm just proud of, I just want to say each and every one of you for being here tonight. Now, we live in a country that basically accepts disease and health problems as just kind of the norm as you get older. It's just what happens as we get older, right? We're going to get diseases and health problems. But the reality is that the majority of health problems today aren't in the elderly anymore. It's in the middle-aged, and it's in our children today. So evidently, that's a false lie. And most of you think that it's, genetics, but here's the thing, or maybe, an age thing, but the reality is that there's really only very, very little that come into play. Maybe 2% is genetics when it comes to disease. 98% of it is lifestyle. Our genes haven't changed in over 5,000 years. Our ancestors, a lot of them came over here from England, right? And they should be getting all these diseases we are, but they're not. They're not getting heart disease. They're not getting cancer. They're not getting autoimmune diseases at the rate that we are. And what about the Amish, right? They're part of our citizens. They're Americans. They don't get any of these diseases. Why not? And then if we look at the Okinawans are in Japan. Well, they have the same risk gene factors that we do, and they're not getting heart disease and cancer at the rates that we're seeing it here. In fact, they have a club there called the Centurion Club. You ever hear of it? There's over 50,000 people in that club, and in order for you even to apply to that club, you have to be at least 100. And these aren't people that are living in nursing homes, and these are people living vibrant lives, living joyful lives in their gardens and having a great life. And so it's not our genes. And if you are still confused about that, who here has ever heard of this doctor? His name's Dr. Bruce Lipton. He's very well known in stem cell research. In fact, he was at the University of Stanford, just up the street here, teaching as a professor. And he's done a lot of research on epigenetics. Familiar with epigenetics, anyone? Well, epigenetics is a study that's becoming very popular because it's teaching us about what our genes do. And what he did is an experiment where he actually took a cell and he cloned that cell until he had many, many, many cells, thousands of them. And then he took those cells, which are identical, and he put them in 3 separate petri dishes. And then he came back in and he put a different environment in each one of those petri dishes. And what he discovered, based on the environment, the different environment he put in each dish, what he found is that each of those cells became different cells. These were bone cells over here, these were muscle cells, these were fat cells. And so what he discovered from that experiment, from that research, is that our cells are dictated by their environment. Okay? This is called epigenetics. Look it up. And so what he's saying from this is that if you put a toxic environment in the cells, it's going to turn on the bad genes. If you put in a healthy environment, it's going to turn on the good genes, right? And so basically, you can dictate which genes you turn on according to the environment that you put in there. So see, health has nothing to do with genetics. He proved it again. Health has everything to do with what we put in the environment of the cells. So most of our patients here, 5 out of 6 people, they know that 5 out of 6 people will die every year in this country, in the United States, from either heart disease or cancer, or they'll contract it, 5 out of 6. Now what that means is that your family, your friends, 5 out of 6 of them are dying and they don't even know it. Because by the time you get heart disease, it's what? Usually too what?
Too late.
Too late, right? And so we don't want to wait until there's a crisis. And that's the other big lie. We tend to think that health is what? How you look and how you feel.
Yeah.
But health has nothing to do with how you look. Health has nothing to do with how you feel. Health is how you are functioning. And so, according to the World Health Organization, health is 100% function of your body. So if your body is functioning the way God intended it to be, then that right there, your body's going to be in an optimal state of health. That's why, you guys are the most educated because you truly know where health is. You're the most educated people in the world, if not the most healthiest in this valley or the country, because you truly know where health comes from, right? We all know where health comes from, but you guys, really know where health comes from. And so, when we look at that, that's the most important thing. So, when it comes to your heart, that's what we're going to teach you here tonight. We're going to teach you how to care for it, how to make sure you never get heart disease to begin with, right? How to prevent that. And if you already have heart disease, if you're on medications, I'm going to teach you what you need to do to reverse that and prevent it from ever coming back again. So when we look at our heart, right, this is an amazing, amazing, amazing organ in the body. Do you realize that your heart has to pump millions and millions of gallons of blood through it every single day? In other words, you have to take all the blood from the bottom half of your body, has to come up in this little 1-pound organ, and it has to go through the lungs, get oxygenated, go back down through the other side, get pumped back out, collect all those nutrients from the intestines that you just digested your food from, and it's got to disperse that to every cell, tissue, and organ in your body. Right? So your heart's pretty important, would you say? Would you agree? It's the pumper in the body. Now, is it the most important organ in the body? No. Why? Because what controls your heart? Your brain, right? But it is pretty important. Would you agree? So what is heart disease? Well, the most common form of heart disease is when that artery in the heart, you might be familiar with, it's called the coronary artery, actually blocks or narrows, and as a result of that, your heart loses blood to it. So the most common form of heart disease is when there's a blockage to the heart. And we always know that when we go to get that test done, right? Because when you get that test, you want to know if it's what? The artery's blocked or not blocked, right? Because if it's blocked, what's it not getting to it? Blood, which carries the oxygen, right? Problem? Big problem, right? And then if a little piece of plaque breaks off in the arteries and it goes up to the brain, what are you going to get?
Stroke.
Stroke, right? And if that oxygen's not getting in the heart, what are you going to get?
Heart attack.
Heart attack. Serious stuff? Very serious stuff. This is why it's so important that you understand and you teach your children and you understand this at a very young age, because when a person has heart attack, how many years do you think it took for that to build in their bodies?
Years.
20 years, right? So if you're going to prevent it, wouldn't it be better to start when you're young, right? But it's good that you get this knowledge tonight, because then you're going to be able to use that knowledge and reverse whatever's going on in your body. So yeah, very serious stuff. So that's why you have to figure out what's causing it and what we need to do to reverse it. Because remember, disease is what percentage? 98% of disease is what? Lifestyle. So what does that mean? Do you have it in your control or not?
Yes.
Absolutely you do. So what is cholesterol? This big problem that we have with cholesterol, right? That's what we're told. It's a big problem. But guess what makes it? Where's it made? Your body makes it. your liver makes cholesterol. It comes in as a waxy substance that's made in the liver. And so if the first question you have to ask yourself is, if my body is making cholesterol, why is my body making cholesterol? Why is my body producing cholesterol? Right? Who created us? God made us, right, Anna? And so God made our bodies, our livers, to do something, and that's to make cholesterol. In fact, the liver has over 500 functions, right? But one of the functions is to make cholesterol. And so, if God made our bodies to make cholesterol, then we have to ask ourselves, why is our body making cholesterol? That's the question. And cholesterol comes in two forms. This is the part you guys are probably familiar with. HDL and LDL, right? Everybody's heard about those before. It comes in two compounds. But if the liver is making cholesterol, why is it making cholesterol? Well, your body makes cholesterol for a reason. It's trying to either heal something, it's trying to make new hormones. If your hormones aren't balanced, it could go up for that reason. Let's say it needs bile acid. Or what about vitamin D? Your body needs cholesterol to make vitamin D. How important is vitamin D synthesis? Right? To fighting cancer. You know, they find that if you're not making vitamin D, your chances of getting cancer go up 24 to 30%. So if we lower cholesterol in the body, how's that going to impact our bodies? Pretty serious stuff, right? So listen, you cannot make estrogen, you cannot make testosterone then, you cannot make cortisol, a host of other vital hormones without cholesterol. Even in women as they're aging, testosterone is very important. So how important is it that our bodies make cholesterol? Very, right? And so cholesterol comes in two forms. The HDL and the LDL, and this is what the doctors are taught. This is what they're taught, right? They're taught that the HDL, which is the good cholesterol, is what they're told, is actually going through the arteries very quickly, and it goes through and it cleans up your arteries, right? It goes through there very fast. So they're not worried about that one because it goes through there so quickly. They believe it's never going to stick, it's never going to plaque up. But the second compound is the LDL, the low density lipoprotein, and that goes through there much slower, right? And the reason it goes through there slower is because it's trying to clean up the things that the first one didn't get. The first one went through there very quickly, but now the LDL is going to go through there slower to clean up whatever the first one didn't. The body is doing the right thing at the right time. Every symptom your body has is your body doing its job. Okay? So now when they give you cholesterol-lowering drugs, they want to what? They want to lower this one because why? Because they believe that when it goes through there slower, it has longer time to plaque up. The problem is when you lower one, you lower the other. So you can't lower one without lowering both of them. So why does your cholesterol go up? Why is your body making cholesterol? It's trying to repair something. Maybe it's trying to make, vitamin D. Maybe you have cancer and you don't know it. Maybe it's fighting cancer right now and it's trying to make more vitamin D. You lower that cholesterol, and what can you get faster? Do you understand? So, when your body's making cholesterol, it's making it for a reason. Every symptom the body has, remember, God don't make no junk. It's doing it for some reason. And you want to find out, why is my body making cholesterol? Why is it making that cholesterol? What is it doing? Maybe it's repairing an artery. Maybe you have a lot of inflammation in your body and it's trying to repair that. Okay? So we don't want to, when we have a symptom, we don't just want to cover it up, right? We don't mask the symptom. we want to ask ourselves, and we should be asking our doctors, why is my body making this cholesterol? What is going on in my body? Let's run some more tests. Let's find out what's happening. The problem is, anytime you take a drug, it has what?
Side effects.
Side effects. Anybody that's on statin drugs will tell you, when they go on these drugs, the first thing their doctors are going to do is they're going to schedule them for lab tests. Why? Because they want to find out if the liver is being damaged. See, the way statin drugs work is it blocks a vital enzyme in your liver. So, remember I told you the liver has over 500 functions? So, if you block that enzyme in the liver, you may be damaging that liver and the function of that liver. How important is your liver? Very. That's why it's called liver. That means to give life. So don't take it lightly. Now, am I saying you shouldn't, you should keep your cholesterol high? We're going to talk about that here in a moment with you. But first I want you to understand some of the side effects of that drug. You should know this. Listen, I don't understand. You guys are going on these drugs and you don't even look at the box to see what it's going to do to you. That's why the side effects are on there, so you can read them, okay? Neuropathies. In other words, it's deteriorating, damaging the nerves in your body. Severe joint pain, ligament problems, muscle wasting, big problems here. I see this now more and more in patients. In fact, Dr. Brass's mom was here with us for 3 months a couple summers ago, and she came in to us and she was shuffling her legs like this. This is a spry woman. She's 85, 100 pounds wet, and she had full of energy. Last time I saw her, I'd never seen her like that. So I asked Mom what was going on. We start to investigate. We realized she'd been on statin drugs for a long time. We went to our MD here. We took her to an MD here at Stanford and said, can you please get our mom off these drugs? And he checked her out and he said, you know what? She doesn't need to be on these drugs. Thank God. Let's get her off of them. Look at the muscle wasting. She can't move her legs. Very big problem. Heart failure. Why heart failure?
Muscle.
Heart's a muscle. If it's atrophying all the muscles in your body, the heart's a big muscle, one of the biggest muscles in the body. Cholesterol is a powerful antioxidant. We're going to talk about antioxidants in just a moment, why this is so important that you don't want to lower these. These are there to protect you. It also protects us against cancer, right? Vitamin D synthesis. So it stops the production of these things. It stops the antioxidants. It stops the vitamin D synthesis. Depression. Who knows somebody that went on statin drugs and the next thing you know, they're depressed? Anybody know anybody like that? I have patients in my practice all the time that come in. They're wonderful. They're full of vitality. And they didn't tell me when they went on one of these drugs some years ago. And next thing you know, they're depressed. They're on antidepressants. What happened? This was somebody that had a vibrant life. And then it stops the production of CoQ10.
One of the side effects is suicidal. Many of
Well,
the drugs.
depression, yeah. Yeah, it can lead to that. So, yeah, so serious stuff, right? Serious, very serious. Now, one of the biggest things it does, and the biggest concerns I have when I look at these drugs, these statin drugs, is that it damages your brain. Did you know that 60% of your brain tissue is cholesterol? Okay? So, when you have these cholesterol-lowering drugs that you're lowering, they're lowering everything all over the body, what's it doing to the brain?
Depreciating.
It's depleting it of the cholesterol, it's shrinking the brain, right? And not only the brain, but the nerves. Every nerve in your body has an insulator, just like a wire in a house. And that's fat. That's the cholesterol. The moment you start depleting the wires, what happens to the nerves? They start to atrophy as well. So you lower the cholesterol with these drugs, and as a result, you start to deteriorate the nerve and brain tissue. Big problem, because when you take cholesterol out of the brain, you block a very important chemical in the body. Is anybody here familiar with serotonin?
Makes you happy.
Makes you happy. We want lots of serotonin. But these cholesterol-lowering drugs actually block the serotonin because it damages the centers where that serotonin is being created. Big problem with statin cholesterol-lowering drugs. Big problem there. All right, and one of the another big problem that we have with statin drugs is it inhibits CoQ10. Now, CoQ10 is actually made by the liver. It's supposed to be. And the reason why CoQ10, I don't know if you guys are old enough to recognize this, but I'd say 25, 30 years ago, there was a big article on the news, everywhere, talking about CoQ10 and what a great find they found this CoQ10 enzyme. And what CoQ10 does is it actually, when you eat food, did you ever think about this? You get energy out of food. How do I get that energy? Well, that CoQ10 actually takes the energy out of your food and uses that energy so you can make your cells. Every tissue, every organ in your body has to be created, right? It needs energy. And so CoQ10 is the facilitator that makes that happen. Now, you guys don't have to film this, because if you notice Zaina over here on the left-hand side, I was going to tell you later, but from now on, this year, all of our workshops are going to be on YouTube. So you can just relax and enjoy yourself tonight. I'm sorry, I should have told you ahead of time. So also the inflammation, we're going to talk about that here in a little bit, that occurs in the body. CoQ10 inhibits inflammation occurring in the body. And then one of the bigger problems is that it blocks, it's the primary building block for your brain tissue. And so statin drugs actually blocks that as well. How important is the nervous system? You don't want to block that, right? You don't want to damage it. You don't want to block it. So, we're seeing a lot of Alzheimer's. In fact, Dr. Brass's stepfather, unfortunately, in the last 3-4 years of his life, had a lot of brain atrophy, and he was on statin drugs way before we met him. Probably 30-40 years, I don't know. But it was so sad to see him go like that. This is one of the nicest people ever. And he was 85, and he was just going downhill. It was terrible. So, Dr. Conger, Dr. Brass, should I lower my statin drugs? Well, am I supposed to leave my cholesterol high? What do I do? We're not telling you to lower your cholesterol. What we're telling you is find out why your body's making cholesterol. Is there maybe something it's repairing, dietarily, and we're going to talk about it here tonight. Is your diet creating heart disease because of things that you're eating? You're creating problems in your blood vessels. Maybe your body is, trying to fight cancer. You need to find out. You need to do some blood work. You need to study yourself. You need to figure out we always say we don't guess, we test. Why is my body producing cholesterol? Maybe it needs to heal an artery somewhere. Maybe it's trying to, clean out an artery, right? That's its job. It's doing its job. Look, guys, if you're on blood pressure medications, high blood pressure is a warning sign. It's a big warning sign. Patients come to us and say, why is my blood pressure high, doc? Well, something in your body is being clogged. Some vessel somewhere is narrowed. And as a result of that, your blood pressure is going up. Why is your blood pressure going up? Because what is it losing to the heart?
Oxygen or blood?
Blood, right? So why does your blood pressure go up? Because it's trying to get blood to the heart. You take blood pressure lowering drugs, and what are you not getting to the heart?
Or the oxygen.
Right? It's lowering the blood. So, again, somebody's going to come up and say, well, doc, what if my blood pressure goes up to 400? We're not saying that. Again, you want to find out why your blood pressure is going up, and you want to work with your doctor and ask them, you know, what's going on, why is my blood pressure going up, and do it naturally to get yourself off of those eventually. Because if you have low blood pressure for 20, 30 years, what eventually is going to happen? If you have high blood pressure, I meant. If you have high blood pressure for 20, 30 years, what eventually is going to happen to that heart that's not getting blood to it? You're going to get a heart attack, right? Very serious stuff. So we take medications because we have to in a crisis. But while we're doing that, we want to work towards getting our bodies healthy and repaired and healing. We're going to show you how to do that here in a moment. So in here, the only way we're going to get you healthy is if we get you healthy at a cellular level. All of us in here have 76 trillion cells in our bodies. And so in order for us to be healthy, we have to heal our cells. Does that make sense? If we heal our cells at a cellular level, then what are we? We're healthy, right?
Right.
And in this office, we do this by teaching you maximize living. So what's maximize living? Well, first of all, we want to eliminate or reduce all the toxins in our diets. That's number one. That's those fast foods that you're eating out there. That's those processed foods, right? And medications, we're going to show you that here in a moment, is one of the main toxins that people put in their bodies. Of the toxic top 10, that's number one. Also, we want to make sure that we maximize our nerve supply, right? Because where does all health and healing come from? To the body, to the nerve supply. So it's important that we maximize that. Then we want to make sure that we're eating foods by God, right? Eat real food, real live food. Okay? It's not real complicated. It's what life used to be 50 years ago. And it's, you know, it seems like an eternity, but it was only 50 years ago. That's how we ate. So, you know, get back to eating real live food. And you got to move, okay? These bodies were created to move. So you have to, you know, make sure that you guys are getting your exercise, and you have to move your bodies. Because if you don't move your body, you're going to what?
Die.
There you go. So you got to make sure you're moving.
Die sooner.
And you got to get your priorities in order. Okay? We got to get our priorities in order. Because if we don't get our priorities in order, our health, our families, God, and the purpose that He put in our heart, the things that we were meant to do, are going to be put aside for things that really aren't important at the end of the day. And then 10, 15 years from now, you're going to look back, you're going to look at where you are in that crisis, and you're going to say, how did I get here? And that's how you got there. Okay? So we got to put our priorities in order. Okay, now the first thing we want to maximize is the nervous system. Most of you guys understand and know that God put the most amazing healing power right up here in this organ. It's your brain. And it has amazing potential to heal you through the spinal cord and out those spiral nerves to every cell, tissue, and organ in your body, in order for your heart to beat, in order for your lungs to breathe, in order for you to digest food here this evening. I don't know, anybody have dinner yet? Just think, 24 organs all have to come together in order to make. How many of you here are even thinking about that, right? That's just a miracle. How awesome we were created. And so we have to make sure that this flow of life, we call it, is happening at 100% of the time, 100% of the day, in order for your body to heal and be well. But now if I put pressure, you see the subluxation right here? Let's say this nerve right here, that's subluxated, can you see that? Let's say that nerve goes to your heart. And Trish, let's say I put pressure on that. Is your heart going to be, how is it going to be functioning?
Not at 100%.
Not at 100%. So if your nerve going to your heart is not functioning at 100%, is that heart going to get healthier or sicker?
Oh,
Sicker, right?
Sicker, yeah.
Right? That the function of that heart is going to go down. And if I leave that there for a long period of time, what's eventually going to happen to that heart? You understand? So that's why, you know, we encourage you guys to make sure that that nervous system's cleared out. How important is that? The brainstem area right up here is an area that actually controls your heartbeat, your heart rate, your blood pressure. Very important. This area here, we call it the atlas. We talk about it all the time in here. And then there's an area right up here at the top of your shoulders. That heart nerve goes right to the heart and the lungs. So we look at a normal you, and then we look at a side view of a normal, should be a normal you. We live in technology era, right? It's the era of the technology. It's good, and it has its flaws too. So we have to work towards making sure that we do everything we can to combat that. So now, the next thing you want to remove are the stressors that are under your control. We all have crazy things that go on in our lives, but there are stressors that are in our control, and there's 3 types of stress: physical, emotional, and chemical. Now, we just talked about a physical stressor, subluxation, we just showed you that, and posture, right? That's a physical stress. Now, you sit at the computer like this all day, you eat some bad food, and you go home, and everybody's misbehaving themselves and driving you crazy. I mean, right there, that's a you know, yeah, yes, that's just a situation waiting, you know, for trouble to happen. So we take care of, I always tell my family, you know, I can't change the world necessarily, but I can change my world. So knowledge is number 1, right? And then from there, we have to apply it. Because what good is knowledge if you're not applying it? You can learn a lot, you can read a book about how to skydive, but if you never skydive, you really don't know about skydiving, right? So you have to apply what you learn. And so the thing is that we want to keep our stressors to a minimum. Because when we have stress in our lives, it creates our cortisol levels to go up. When your cortisol levels go up, it makes you acidic. I've never seen a patient in our office who had cancer, heart disease, any kind of chronic disease, who wasn't acidic. So we want to reduce these stressors in our life, and that's why subluxation being corrected through adjustments is so important. When we eat, we can reduce blood pressure by what we put in our mouths, and you're going to see that here in a little bit. And of course, we can control the stresses of our life. We can take a nice deep breath and try to calm down when we're going through those moments. So I want to share something here with you.
Blood pressure, it affects millions of people. In fact, 1 out of every 3 Americans. And if left untreated, it can be deadly.
To show
Most
you
people
how
take medication to control it. But as Kate Merrill shows us, some
controlling
patients have found a simple way to
subluxation
keep their numbers down
can impact
without drugs.
your cardiovascular system.
The mad dash
This
to get the kids
thing
to
that you see
school,
here, I'll show you in a moment.
the crazy commute, and especially work. It's enough to raise anyone's blood pressure.
We work on deadlines, and with all the law changes, which keeps me in business, but keeps us also pretty stressed out.
Soon, that pressure from running his Cambridge accounting firm began to take a toll on Adrian Kaspar. He was forced to go on medication to control his blood pressure.
I believe in not taking medication, but blood pressure you don't fool around with.
I just have you sit right here, Adrian.
That's why he came
Good,
here
thanks.
to Dr. Peter Martoni, a Linfield chiropractor, who's using a new adjustment in the neck to help bring down blood
By the
pressure.
way, it's not a new
Now, if a
adjustment.
bone is
She
out of
was
alignment, putting pressure
misled
on the
there.
nerve, it
It's the
interferes
same
with
adjustments you've been getting in
ability
here.
for the heart to function
You get the
correctly.
same
In
adjustment.
about 2 or 3 weeks, my blood pressure
Does
was
that
normal.
only lower blood
Bill
pressure,
Bird
or
of
does it
Stoneham
also
sells cars, another stressful
raise low
job.
blood pressure
He
to
was
like
also on
normalize
blood
it?
pressure
Normalizes
medication.
wherever your
After
body
a few
needs
visits
to be.
Dr. Martoni, his doctor cut his medication in half.
Another 30 to 45 days, my blood pressure staying at the levels it is, I'm gonna be off at 100%.
This treatment is experimental at this point, but studies show
not
it might
experimental.
actually work.
This is a
Been
very
doing
novel
chiropractic for
concept.
120
Dr.
years.
George Bacris is an expert in high blood pressure.
It's
He's
new to
conducted
them.
a small,
It's
carefully
experimental for
controlled
them.
study with some of his patients at the University of Chicago Medical School. He sent them to a chiropractor for the same adjustment Dr. Martoni uses.
We saw miraculous changes in blood pressure. We're seeing 12, 13 millimeter reductions in blood pressure.
The results were dramatic enough to catch the attention of the federal government. The National Institutes of Health is now funding a larger study to see if they can duplicate the findings.
Even Dr. Vacris admits there are a lot of unanswered questions.
I think we'd have to really find out what's going on. Why is this happening?
But Adrian and Bill say they have all the proof they need.
I've never felt better.
I just feel better, and feeling better is the way to be.
It's tough to argue with an outcome like that. Kate Merrill, WBZ News.
Dr. Vacris and Dr. Martone say patients should not stop taking their blood pressure medication.
Obviously. The only person that can take you off of your medications is your own MD, right? But that doesn't stop you from doing the things you need to do to care for your body, right? So obviously chiropractic adjustments play a vital role in making sure that we prevent heart disease from happening and to reverse any kind of blood pressure issues that it might be going on in your body. So the area that we adjust up here is called the brainstem area. That's what controls all of this. And when you get adjusted, it's an area that we pay very close attention to on x-ray. And when we're making adjustments, we're making sure that that area is being corrected and cleared out. So how many of you here get Time Magazine? Anybody read Time Magazine? Well, this is an article that was in Time Magazine 13 years ago. And in case you're wondering, it was done not by medical doctors, but by scientists and researchers. And what they found 13 years ago, that the cause to 98% of all diseases is what? Anybody know what it is?
Inflammation.
Yes, inflammation. They found that it's inflammation that causes 98% of all diseases. Now that kind of fit in with what Dr. Lipton discovered, right? So they're onto something here. But when I was growing up, we were told, oh, your mother has heart disease, your father has heart disease. Oh, your mother has cancer, your sister has cancer. You're going to get it. Okay? So now the scientists are saying, no, that's not right. So isn't that a refreshing thought, huh? Isn't that an optimistic thought? So 98% of all disease, chronic disease, is caused by inflammation. So if we want to get healthy, if we want to reverse chronic disease in our body, then what we need to do is we need to make sure that we are reducing or eliminating inflammation in the body. And you say, how do we do that? Well, we're going to talk about that here in just a moment. But the first step to healing your cardiovascular system or your entire body, all the cells in your body, is to reduce inflammation. Okay? And it's all science. The books that you have, the cruise ship book and the other book, that's all based on research that's out there. We just wrote about it in the books. Okay? So you can go and you can do some. So I know some of you are researchers, you like to look this stuff up for yourself. But if you never want to get a heart attack, if you don't want to get cancer, if you don't want to get autoimmune diseases, you have to keep the inflammation down. Okay? So how do we do that? Well, there's 4 causes to inflammation, and here they are. Number 1 culprit is sugar. In fact, sugar is a known toxin. You can't have more than 2 teaspoons of sugar in your body at any one time or you'll go in a coma. That's why your body takes that sugar and it puts it into a cell. It tries to get it stored somewhere right away. And so sugar is a culprit. Now, we're not just talking about that white powdery stuff. We're talking about everything that turns to sugar. Oh, Roberta's, oh. Okay. What else causes inflammation in your body? Damaged fats, bad fats. Now, we're going to talk about fats here in a moment. But, in the big cities, like New York City, some of these other cities back east, they actually outlawed trans fats because it's so damaging to our health that the fast food chains are selling all these processed burgers and french fries and all these different fats that are really damaging to the body. It's actually destroying our bodies. And so we're going to go over the difference between healthy fats and good fats, because there are good fats, and we're going to talk about it here in a moment. Mm-hmm. Toxins. What kind of toxins? Well, foods have a lot of toxins in them, right? So when we took you to Whole Foods, we showed you where the good stuff is. But you have to be careful over there because, you know, there's some things in there that, you know, read the labels. So I'm gonna tell you, just read the labels. But we're full believers in their meats and, you know, the organic foods. Again, real food. Eat as much real food as you possibly can. Acidity, that's the fourth one. And we're going to go over these individually. I'm going to show you where those things are coming from. But here's basically what happens. We'll call this agitators. The sugar, the bad fats, toxins, acidity. They come through your artery and it's just like, you ever hear fingernails on a chalkboard? So it's just basically scratching in there, right? And then what happens is the artery becomes inflamed. And now the liver goes, whoops, there's a problem over there. What's the liver going to do? What's it going to make? Cholesterol. It's going to say, we got to repair that. So let's take this waxy stuff and patch it up in here. And as long as there is no oxidation there, then that artery will be repaired. Now you reduce your inflammation and your artery's fine. But if that cholesterol oxidizes, it forms plaque. And now that plaque starts building up, and where we had nice big flow of blood here, started to reduce from the inflammation, now it can barely get through. Because now the inside of your artery is starting to close down. Seriously, severely. So it's not cholesterol that causes cardiovascular heart disease. It's the oxidation of cholesterol that hardens it. Have you ever cracked open an apple and you open it up and you see that it's, after a while, it gets brown? It oxidizes. That's what it does inside those arteries. And remember I told you that CoQ10 helps the body with antioxidants? How important antioxidants are? This is where they play a role. Because we don't want that repair. Well, first of all, we don't want the inflammation. But if we have the inflammation there, we want to make sure that we have antioxidants in there that's going to prevent that from hardening up. Okay? So, it's winter. It's the holidays. And next thing you know, you look around and everybody's sniffling. Oh, it must be cold season, right? It must be, you know, the reason why so many people get sick, it must be the flu season. Flu season started. That's what it is. Everybody's giving me the flu. Well, did you know that there is something that you ingest around the holidays on a regular basis that can lower your immune system for 8 hours? 8 hours.
Eggnog.
Eggnog. What's your favorite?
Cookies.
Cookies. What's your favorite?
Dessert.
And you know, I don't think we go 8 hours around the holidays without consuming some kind of cake or candy bar or cookie or whatever it is. So the next thing you know, somebody sneezes and you got the cold. You caught it from someone. You didn't catch it from someone. Your immune system wasn't working right. Why? You see, most of the mess we're in, we've created. We create our own mess, and then we blame it on somebody else. Isn't that human? We all do it. So, next time you go through the holidays, remember what sugar's doing in your body. Okay? And look how much the American public eats of this a year. How many pounds a year does the average American eat? Around the turn of the century, what do you think this was? I think it was less than 10 pounds.
Just didn't have sugar.
Per year. Doc, I'll get it.
I got it.
Thank you.
The chances are good that sugar is a bigger part of your daily diet than you may realize, which is why our story tonight is so important. New research coming out of some of America's most respected institutions is starting to find that sugar, the way many people are eating it today is a toxin and could be a driving force behind some of this country's leading killers.
There's
including
renewed
heart
debate
disease.
this morning about the health effects of sugar on millions of Americans. This after a controversial New York Times Sunday magazine cover story. The proposed sugar is in fact toxic. It even suggested sugar is as dangerous as cigarettes and alcohol.
Is sugar toxic? I believe it is.
Motivated by his own patients, too many sick and obese children, Dr. Lustig has concluded that sugar, more than any other substance, is to blame.
What are all these various diseases that you say are linked to sugar?
Obesity,
Type 2 diabetes, hypertension, and
The
heart
liver
disease
is
itself.
overloaded with fructose and converts some of it into fat. Some of that fat ends up in the bloodstream and helps generate a dangerous kind of cholesterol called small dense LDL. These particles are known to lodge in blood vessels, form plaque, and are associated with heart attacks.
What happens is over an amount of time and years, and we don't know how much sugar and how much time, the pancreas can get worn out. It can lead to diabetes. There's also, though, new research that suggests that insulin really works as a growth factor to trigger and stimulate and feed and nourish tumor cells, and therefore implicated in
Limit your
cancer.
sugar. You decrease your chances of developing cancer.
absolutely.
Addiction to sugar can be as powerful as one to tobacco or alcohol and can be as difficult to break.
Sugars can hijack the brain, stoke the appetite.
But what are some of the common side effects of sugar addiction to help us identify if maybe we are suffering from one?
A real biggie would be fatigue. Those people out there that are exhausted all the time, they can't sleep, weight gain, people have sinusitis, spastic colon, even depression and anxiety. There's a common problems that make people's lives miserable, and they're being driven by the sugar addiction.
Containing sugars can actually alter the way the brain is supposed to work.
Salt. It's in salt.
Obvious things
Table
such as
salt.
table sugar, honey, syrup, sugary drinks, and desserts. But also just about every processed food you can imagine, where sugar is often hidden. Yogurts and sauces, bread, even peanut butter. And what about the man-made, often vilified sweetener, high fructose corn syrup?
If it is to be, it's up to me. Who's responsible for our life? Right? And now that you know this information, right? Now you can act on it. That's the great news. Fat makes you fat. That's a myth. I remember when I was a little girl, my mother, bless her heart, she went up to 200 pounds and she went back down. And she went back up to 250 and she went back down. And then she went back up to 300. And she used to say, you know, we're gonna stop eating fat in this house because fat makes you fat. In fact, in the 60s and 70s, everybody believed that, right? But the reality is that fat doesn't make you fat. It's the inability for you to burn fat that makes fat stored in the body. In fact, healthy fats actually help your body to burn fat. So before you asked Linda about fats, what kinds of fats, you said? Well, there's two kinds of fats. There's healthy fats, and then there's the fats that make us sick. So eating fat is very important in your diet because everything about our bodies has fat. Our brain is 80% fat. Our nerves are insulated with fat. Every cell in your body, there's 76 trillion cells, every cell has 2 layers of fat that's wrapped around it. So our nerves are protected by it, our organs are protected by it. Our bodies need fat, but it has to have the healthy fat. You have to have healthy fat on the cell wall just to let things come in and out. If it's bad fats, it clogs the cell and things can't get out, toxins, and good things, nutrients can't get in. So fat is crucial. I hear young people all the time say, oh, I'm just going to stop eating fat. Okay? So that's a myth. Your body needs fat. In fact, in the 60s and 70s, butter and meat consumption dropped by 50%. I remember this because my family was one of the first families to go out and buy a product called margarine. Elias, have you ever heard of margarine?
I've heard of it, of course, but I don't know.
Yeah, who knows what that is? It's like a
I don't use
plastic. It's like a plastic butter almost. Is how I'm going to describe it to you. It's disgusting. Okay. My grandmother used to say, and oh man, she was a good Polish cook and the stud of Bubba in the kitchen. What's the point of living if you can't eat fat butter? And she was right. We thought she was eating unhealthy, but her instincts were telling her to eat butter. So you want to make sure that you're eating real food, and margarine obviously isn't. Do they even sell this in the store anymore?
Yes, we do. Yes.
Okay.
Very much so.
All right. So here's the
Tastes like
deal.
butter.
All right. All of these things supposedly were improving our health. What happened to heart disease? Rose dramatically. So here we are, Time magazine. Sometimes these magazines actually get it right. I saw this article come out, and I was so excited. I read this article and I went, wow, they got it right. Do you know the French eat the most butter in the whole world? And I think they're like number 2, or they're up there in the highest countries of health.
You should have seen my culinary school thing, because it's a French culinary institute, was what it used to be.
Okay.
And we use butter so much.
So much.
It tastes so good.
My mother,
Chef,
my
put a little
grandmother,
butter on it.
she would love my grandmother. She'd take a pound of butter and throw it in the pan before she started sauteing the onions. I swear to you, it looked like a pound. But, butter is very healthy for you. So, you know what? Start buying your organic butter again and give it to your family, because it's going to create health in your body like you've never seen before. The first thing when somebody's inflamed, the first thing I want to see them do is get healthy fats back in their body. Start healing.
And the regular butter doesn't say organic.
Yeah, so good, better, best. We like raw butter, organic. That if we all could eat that right here today, that'd be primo. Hard to get.
Avocados are really good too.
What is it?
Some fruit, avocado.
Yeah?
Avocado.
Avocados. Yeah, we'll talk about good, healthy fats.
If you can pack all of human history into 1 year, we've only been farming and eating grain since about yesterday, which is when we became shorter and fatter. We only started consuming processed vegetable oils about 10 minutes ago, which is when heart disease became our #1 killer. So after examining all this human history, the experts came to the obvious conclusion. We need to eat a lot more of these. And so they convinced us that human health depends on foods we didn't eat for more than 99% of our entire existence. How did this happen? In the 1950s, a biochemist named Ansel Keys published a study that compared heart disease and fat consumption in a half-dozen countries. The more fat, the more heart disease. The trend line was unmistakable. Just one little problem. Keys left out countries where people eat a lot of fat but have very little heart disease, like Holland and Norway. He also left out countries where people don't eat much fat but do have a lot of heart disease, like Chile. In fact, Keys had reliable data from 22 countries, and the results were all over the place. But you can't make a big splash in the scientific community with a trend line that looks like this. So Keys did what any dedicated researcher would do. He threw out the data that didn't fit and published his results. His punishment for this bit of scientific chicanery was to get his picture on the cover of Time magazine. Keys became known as the father of the lipid hypothesis, which says that eating saturated fat raises the cholesterol in your blood, and high cholesterol in your blood clogs your arteries and causes heart disease.
The hypothesis that when you eat high fat, that produces high cholesterol, and the cholesterol produces heart disease, is wrong in every one of those links.
This whole idea that dietary fat causes cholesterol problems is sort of a myth. The whole idea that cholesterol problems lead to heart disease is a myth.
The theory is completely and totally wrong. It was a theory that was made out of whole cloth and then pushed.
The term
artery clogging saturated fat, it's as though it's all one word.
It's become part of the zeitgeist. Everybody knows saturated fat is bad for you, but when you get back and you start looking at the medical literature and you root back through to find out where this whole idea came from, it's bogus.
So, I'm not going to stand here and read the whole article to you, but that's basically what this article was about. It quoted Ansel Keys in there and gave you the whole history. I found it very fascinating. I had to, make my own notes there. I had to write out exactly, because the history was so long of how they went back and they studied the whole thing. It's a great article, by the way. This isn't that long ago. This just came out in 2014. It's the June issue, June 23rd issue. Yeah, you probably go to the library and research it up. But excellent, excellent article, give you the history on fats. Now, here's the thing. What went wrong with this study that Ansel Keys did? Well, here's what went wrong. See if I can say that 3 times fast. What wrong? The studies that they did were all on conventional meats. So you notice the low-fat craze that happened in the 60s and the 70s? Well, that happened to coincide with the same time that McDonald's business was growing big. In fact, they couldn't keep up with the production of having enough meat to get to slaughter to get the burgers on the, conveyor belt. So what they did is they decided they were going to fatten up the cows quicker and get them to slaughter faster. So they started feeding them what? Corn. They started feeding them corn. And what does corn become in your body? Sugar. And what does sugar cause in the body? So the cows were inflamed from the sugar, from the grains and the corn that they're eating. Now the cows are inflamed, and now we eat the what? We eat the cow. We eat the inflammation. So they were creating inflammation in these cows, and people were eating it, and so the cows had healthy or unhealthy fats in their bodies. They had unhealthy fats. So the saturated fats that they're referring to are on all of these cows that in that time frame into today, you go into Safeway, all of our stores, all the conventional stores sell the same kind of meat. It's corn fed. Yeah. So that's what happened. That's how that study, part of how that study got skewed, because it was, if you look back, you trace back the source of the animal that they were studying, that the people were eating, that was the problem. Okay? So the fat meats causes heart disease, cancer, osteoporosis, and kidney disease. True or false? True. What's that? False. So myth, right? Your meats have saturated fat in them, and there's been meat-eating societies have been living on this earth for centuries. And they're not getting heart disease and cancer. This meat-eating thing, I was a vegetarian when I was young, okay? But if you look at, and I was unhealthy, I was really unhealthy. If you look at our intestines, we're not carnivores, we're not herbivores, we're omnivores. What does that mean? Our intestines are designed to assimilate both vegetables and meat. So if you want to be a vegetarian, you're thinking that we were designed to be vegetarians, you just look at us from an anatomical position. We honestly are not designed for that. We're designed for all of it. But the reason why we want to make sure we get saturated fat in our body is because we need vitamin D, which, are we high in vitamin D as a population in the United States or low?
Low.
Why do you think we're low?
We're too inside.
We're inside too much. That's part of it. And then we're told never go outside because you're going to get cancer.
And if you do, you put on sunscreen.
And you slather yourself with sunscreen, which